Just preparing to live stream. Please wait a minute.
See it.
We're good.
Okay, I'm going to call the meeting of March 9th, 2021 of the Town of Northborough Board of Health to order. And the first thing we're going to do is take a roll call of all members present. I am Glenn French. When I say a name, just say present. We have Teresa Capobianco
Present.
and Dilip Jain. Dilip Jain,
You're muted.
he's muted.
Present.
Okay, and not present this evening is Dr. Sane, but we can proceed with the three of us. And so the meeting's called to order, and the first course of business, we turn it over to Ms. Black to handle the administrative task of reading Governor Baker's March 12th, 2020 standing order.
Okay, great. Thank you, Mr. Chair. This meeting is an open meeting of the Board of Health. It's being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirements of the open meeting law to have all meetings in a publicly accessible physical location. All members of the Board of Health are allowed and encouraged to participate remotely. The order will allow the Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Each vote taken by the board will be conducted by a roll call vote. Thank you, Mr. Chair. I'll hand it back over.
Okay, first thing on the agenda this evening is approval of the January 12th minutes. I've read them and I have no changes to propose. Does anyone else from the board have any changes or comments regarding the minutes?
No.
No.
Okay, then could I entertain a motion, please?
I motion that we accept the meeting minutes from January 12th, 2021 as posted.
Second.
All those in favor?
Aye.
Aye.
So we got Dr. Jane in favor,
Aye, yes.
Attorney Capobianco in favor,
Yes.
and I am in favor as well. Minute meetings are approved. Meeting minutes are approved as well. Second thing on the agenda this evening is the COVID-19 update. And Kristen Black, could you please take it away?
Okay, great. So I just want to make sure, does that work for you? Can you all see that or is the screen broken up?
Nope, we
I
can
can
see it.
see agenda items.
Great. So I'm just going to progress along. We did have quite a few updates on the vaccination plan since, we've last met on January 12th. So I'll walk through the case count updates, some updates on the state's reopening plan, contact tracing, as well as COVID-19 vaccination today as we progress. So I just want to show you the risk status and weekly case counts. So this is the most recent public health report, but that's produced by bear with me, by the Mass Department of Public Health. These numbers were released on March 4th, so just last week. I want you to just pay attention that we are currently still yellow. We had 23 new cases in the last 2-week window, according to this weekly public health report. And so the dates of that 2-week window were February 14th to February 27th. But I think it's worth noting that we've had a severe drop in the number of new cases. So at our January meeting, in contrast, that same 2-week window, we had 107 new cases. So we're seeing, a steep decline in the total number of cases. Our percent positivity for the number of PCR tests that are coming back positive is currently 1.25%. Back in January, that number was closer to 5%.
Oh,
And so again, that 5% trigger was where we were seeing the community was red, according to the state's color mapping. Overall, as of tonight, this afternoon around 2 p.m., the total case counts in the town of Northborough were 1,085. I think it's noteworthy for all of you to realize that, tomorrow, March 10th, will mark the first positive COVID-19 test administered in the town of Northborough. So it's been a full year. And we've seen over 68 deaths in the town of Northborough. So it's a sad moment to mark. And we've had a lot of loss in town. But luckily we're here to talk about some of the hope and the progress on the vaccination. So I did want to point that out. As of tomorrow, that was 1 year to the day of the first positive test administered for the town of Northborough. Go ahead, Teresa.
I'm sorry, I just have a quick question on the testing numbers. Are those just the PCR tests, or does that include rapid tests as well?
No, it's just PCR tests. So the state's just reporting. Yeah, some of those, the antigen, the other tests are not reported in those numbers. They are found elsewhere in the state's public health data, but just not on the local specific information, the town by town data.
Perfect, thank you.
Okay, you're welcome. So just this week's in numbers, again, these graphics are put up once a week on the town of Northborough's website under the COVID-19 banner. Again, still the red banner at the top of the state's webpage. So the numbers I just presented on the previous slide are just shown on this one graphic here. So again, everything's lower. We're seeing our numbers come down, percent positivity on those tests, the number over a 2-week average, but we are still moderate until those cases drop a little bit further. So we're going in the right direction. I think this graph is helpful so you can sort of see week by week, the trends and where things stand for us. So as you can see here, as of last week, or the ending on February 27th, we dropped to only 10 cases in a week period. But I do want you to realize also that's going to bump back up. So we did have a lull, and I'm just looking ahead at the numbers in this past week. I think we're going to be closer to 19. So it's not like we're totally bottoming out. We are seeing a little uptick, which is similar to what surrounding communities are seeing. So people are saying maybe it's related to travel associated and activities with February vacation. So who knows, but again, we're staying much lower, but it's not really over yet. So that's something to keep in mind. So again, reopening Massachusetts update. So when I say reopening Massachusetts, I'm talking about like Governor Baker's big reopening Massachusetts plan on their state website. So a recent change that just happened, I guess effective on March 1st, is that the Commonwealth officially moved into phase 3, step 2. So, there were some changes to the restaurants and open hours. The curfews have been lifted. We're back to where we were like pre-Thanksgiving. That's the phase 3, step 2 that we're all in. No huge drastic changes. Overall that, it was more of the same we're used to, but not the restrictions we saw after the holidays. And then effective March 22nd, again, this is subject to public health data. The Commonwealth of Massachusetts is anticipating they're going to move to phase 4, step 1. This would allow like larger venues, let's say like arenas, to open again at restricted capacity. But we will see some more things opening as we move to this next step. And they're projecting that opening date would again be March 22nd. So that's all contingent upon the numbers continuing to like stay low or decrease. So in all of these updates, I know it's hard for me, and I'm sure it's hard for businesses as well. to keep up with, where are we now? If I have an outdoor event, how many people can I have? How many people can I have at that picnic? It's 50 degrees out. Maybe I'll have a,
Yeah.
campfire in the backyard this weekend kind of thing. So all of those restrictions are summarized on the Town of Northborough's COVID-19 webpage under business resources. It's really everything about reopening. So I did direct links to, the standards for gyms or offices or, any of those different categories. So we'll refer people there. They're always welcome to call the health department with questions. And just today, there were some more updates from DESE, which is the Department of Early and Secondary Education, which has now released timelines for returning to in-person learning for grades K through 8. So the school department is working really hard on that plan. They were originally talking about a 4+1. They have all these fancy names. That was 4
Yeah.
days in person, 1 day remote. But DESE or the state is coming in and really saying, no, students need to have the opportunity for full in person. So they're taking that 4+1 model and they're going to a straight up 5, like every other community across the state. So phasing in, I believe it's great, maybe K through 5. That reopening date, I believe is it 4? Yeah, the April 4th or 5th. So again, I'm not going to quote any of it. It's all there on the doe.mass.edu/COVID-19. You can see all of those updates. So I just want, if we don't talk too much about contact tracing, that's been happening behind the scenes for quite a while in Northborough. As you all know, we contract our nursing services with Salmon VNA and hospice. They're continuing to work with us. We've paid, we are paying for an additional addendum or contract with them in these like high surge months to help cover that. So they brought on some additional staffing. You've been around, Ann Labonte is our public health nurse and our main nurse, but she was covering 10 towns. So could duplicate herself. So they needed to add some nurses. So we've been we have their support and are still looking at that to see where our current workload is and whether or not we need that additional staffing moving forward. We're definitely down to below 10 new cases a week, I think is sort of our trajectory. It's something that Salmon VNA is probably able to handle in-house without the additional support. And we also do sometimes refer our cases to the Community Tracing Collaborative, and that's the state wide program. I want to say about 90% of the overall cases in the state of Massachusetts are being handled for contact tracing through CTC, or that was the last update I heard. That group is doing a really good job. Back in the day, we didn't want to use them. You might remember, like, we don't want to send our cases because they were, days and days behind, but they've really ramped up and, they're responding and calling residents in town within 24 hours of a positive test result, appearing through the state system. So we do use a blend because we don't want our public health nurses to work to the bone over the weekend. They're doing a nice job. And I think it's really important. And I don't know if I give enough credit along the way. Mary Ellen Duggan, who's an RN, also our school wellness coordinator, she assists with contact tracing at the school. So Mary and Ellen and I are in, contact at daily, most times just to go over individual cases, contact tracing for a sports team or, a parent who's traveled and if they're a household contact and whether or not we're doing quarantine. So it's really a joint effort. And I just wanted to highlight again to all of you that it's really these 3 entities, Salmon VNA, the CTC, and Mary Ellen Duggan, and that great support from the schools. Not all schools are offering those services or doing it quite as well as Northborough, Southborough School District. So I just want to point that out to all of you.
Good.
So it just, this is the same graphic you keep seeing forever. It's right in the middle. We're here in phase 2. We're going to be ready to step into our second bullet. Actually, this is the old graphic. Now there's 3 bullets, but let me just talk about who's currently eligible. Again, we're in that phase 2 and we'll be moving on to, as this graphic shows it, the second bullet, and I'll cover that in a minute. So just updates for specific to the town of Northborough. I think a lot's happened since we last met on January 12th, and I've seen a few of your faces since then. You've been able to experience our vaccination clinic at the senior center, but to date we've held a total of 4 vaccination clinics at the Northborough Senior Center for eligible individuals. This is obviously a joint effort with town departments, with the fire department, providing EMTs, paramedics, and really Chief Parente being the king of logistics and doing a fabulous job and supporting us, and the full health department with Katie and Angie in the background helping to schedule people and present their day of. We've pulled municipal staff from multiple departments to support this. one day a week Friday clinic. We've had our town clerk there and our recreation director and, I'm missing people, but all over, it's really been a great team building exercise. Everybody's really supportive, wanting to be part of this. So while we figured it out, we solved the problem locally, the state comes in and Secretary Sutter sent a letter on February 17th, as many of you are aware. This was forwarded to the board, stating that effective March 1st, there's no more first doses going to sort of standalone municipal clinics like ours, unless they were identified as a top 20 community in Massachusetts for COVID. Local towns like ours can't stand alone with a clinic anymore. We, as a local board of health, are being asked by the state of Massachusetts Department of Public Health to support homebound vaccinations and to support vaccinating for affordable housing clinics. But really, that's our role, and it's limited to that at this point. And it's mostly stated as being given to the limited vaccine supply. Governor Baker has really focused his effort on these mass vaccination sites. However, it's worth noting in Secretary Sutter's letter, she also drew attention that municipalities could propose regional collaborations that have to, meet a specific geographical need and also other specific requirements. And this is the be able to vaccinate 750 people a day, 5 days a week sort of threshold we're talking about. So I wanted to update you that last week, Northborough, on behalf of 8 communities, came together with a regional proposal to do just that, to be able to meet their current, requirements. The proposed location, because the Northborough Senior Center couldn't handle 750 people a day, or a municipal building have that wear and tear. So the proposed location was the Doubletree Hotel in Westboro. And the towns that were part of that application included Ashland, Boylston, Holliston, Hopkinton, Northborough, Sherburne, Southborough, and Westboro. And we're really waiting on a response at this point from the state. Dr. Jane, yeah. Oh, you're on mute.
Unmute. Question for you. So in those 4 vaccination clinics, how many people did we vaccinate in those 4?
You're jumping to the next slide. I can go right there. So let's go. I just have one. I'm going to show you on the next slide. If you and just I want to know one more thing on this slide before I forget. On the DPH call today at 3:00, the state noted that any of these regional sites, by the way, would have the ability or their discretion to set aside 25% of their doses, like to their residents or specific teacher clinics. So there's some advantages, but again, all of these regional proposals moving forward do need to be open to everyone in the Commonwealth and posted on the state's publicly available site, that VaxFinder. But Dr. Jin, to your point, so here are some of the numbers from the 4 clinics we've held so far. So everything in black, these are the first dose clinics we've already held, or second dose. Anything in red is planned second dose clinics. So to date, as of Friday, we've vaccinated a total of 705 individuals.
Okay.
And then we just have those 4 remaining second dose clinics planned at this time.
So basically the town received about 1,410 doses, 705 for the first vaccination and 705 for the second doses, correct?
No, 605, I would say, or so, because if you can look on the line on the March 5th, 107 of those were already second doses. So
they've already been given. Yep.
Yep. So yeah, we're around 600, individuals that will be vaccinated.
Okay.
Yeah. If you have any other
Well,
questions.
Kristen, I think you and the gang did a wonderful job on that stand-up situation. I think you really helped out the town, and you all worked very hard, so you should be proud of that. And I'm proud of you for taking that bull by the horns and really getting into it. So I would just want to thank you for the record that you did a great job.
I would
Thank
agree. I would agree because, one of the emails that you had sent out that some of the towns are having trouble finding the Board of Health people, the agents, that, they've lost some people. So obviously that more burden has had to fall onto you guys who are still here, help us run this public health program. So yeah, great job.
I think it was fantastic.
Yep, it was very well done. You got a lot of compliments from a lot of the people who rolled through those clinics. You know, I
Good.
met with a lot of them in doing the rescheduling for second shots, and they were all very complimenting of the process that was put together and how streamlined it was and how easy it felt for them to get in, get shot, do their waiting thing, and get out the door. They were very appreciative that it was so easy for them. So that's a testament to your leadership on this.
Yeah.
Yep. I can tell you, compared to the state website, the CVS website, and the Walgreens website, much better.
No, we
I won't
appreciate
even go down that road.
No, it's been a great way to get to know the community, and I can tell people it's so fun to give people what they want right now. So
Yeah.
you get to get this hero mode, but it's been an incredible team building exercise, and I think what's really touching for me is these first responders who have been front lines doing transports through the thick of it. Early on when we didn't know how to protect ourselves and the risks, like they were there, and I think they're really enjoying being part of the solution and the vaccinators on the other end of it. And so it's been great that we could offer that locally to all of them. And for some of our staff that have come on board, like myself, during the pandemic, and it's an opportunity to meet other staff members in person because we've all been fairly isolated. So it's overall great. The senior center has been incredible hosts, and also coordinating everything from signups to transport, et cetera. And part of these numbers too, this includes, I think we did a total of 9 homebound vaccinations already. So, some communities are just starting to talk about that. We went through that very early, and just total number on seniors. It's a little tough because, I feel like the state's moving ahead so quickly with educators, and the supply isn't there. And it always feels like we're leaving a group behind. I
Right.
think ideally you wouldn't want to, in a town, move to the next category of 65 and over, for example, until you did your 75-year-olds and
Yes.
older. And so I was very grateful to many volunteers coming together we actually called every senior on our census list and made sure they had an appointment or offered it to them and registered them. Went so far as we had some names, we didn't have phone numbers, and the police department assisted us. So hope we didn't bother anybody too much, but we made calls and really, I think, really got to that 75 plus list. I'm sure there's a few people, that may have just slipped through the cracks and, new to town or not a registered voter or something along those lines, but we're still helping to assist people individually, special circumstances, so it's homebound or you're 75 and over. And we'll continue to do what we can to help current groups, which are really being sent to the state to register online. I was just typing up an email to our teachers to share some tricks for them. There's some interesting, Twitter accounts and bots people have made to send you notifications. I just signed up for one on my phone. There's a CVS one. I found some of these resources. It was a Boston Magazine article of how do you navigate it and find it? 'Cause some people are getting appointments, and some people I've heard have been on for 3 weeks,
Right.
trying to get one, and they're just having no luck. So there are some interesting, new tricks. One, you can sign up for notifications when CVS in your area has open appointments, so you don't have to spend your whole day online. There's some bot that does it and sends you notifications. So we'll try to publish some of those tricks. I wish we could just register people, but at this point, it's just connecting them to resources. So I guess we'll, just to, finalize on the regional proposal, we'll let you know as soon as we hear anything. It was briefly covered on today's call with the state, with Jana Ferguson, Assistant Commissioner. They said because of the limited supply, they're really not looking to open too many new vaccination sites
Right.
at this time. So that probably includes us as well. So we'll just have to hang tight and see where things go, shake out. So some important updates just this week for all of you. If you're vaccinated or you know someone who is fully vaccinated, the Center for Disease Control just released this recommendation for fully vaccinated individuals. If you read it on yesterday, they even made another change today where they removed the 90-day definition from fully vaccinated. So this is the most current. You can find this, it's linked on our COVID news webpage as well, but it's just stating that individuals are fully vaccinated. So if it's a 2-dose series, that means you've received your second dose and you're at least 2 weeks out from that shot. Or if it's a Johnson & Johnson, you're at least 2 weeks after that single vaccine, you're considered fully vaccinated. And so although we want you to continue to take preventative steps while out in public, there are some new exciting updates for grandparents especially. I can speak to my own parents about this. So the new recommendations state that if you are fully vaccinated, you can gather indoors with your fully vaccinated people without wearing a mask. So if you're all fully vaccinated, you might be able to have that dinner party you've been waiting for the last year with friends. And also, it's worth noting that if you are fully vaccinated, the CDC is recommending that you can gather indoors with unvaccinated people like grandchildren from one household and without having to wear a mask. Again, unless the people that you're gathering with are at increased illness or severe illness. So if any of the unvaccinated individuals. And the other updates that are important, I'll cover this as well in the next slide, that now also if you're fully vaccinated and you've been exposed, being a close contact or within, 6 feet for 15 minutes or more to someone with COVID, you don't have to quarantine or get tested as long as you're asymptomatic. So that's a big update for people and hopefully an incentive for individuals who are maybe on the fence to get vaccinated.
Which is what, 25% of the public is hesitant about getting vaccinated.
Yes.
Right. So, and so this further was extended into our Massachusetts travel order, was just updated this week with a section specific to, again, these fully vaccinated individuals would not have to quarantine or produce a negative COVID test if they travel to a non-lower risk state. So again, that's all on the state's travel order webpage. And just want to, remind people of that. So again, just to go over the timeline real briefly, our currently eligible groups are all of our phase 1 workers. These are all our first responders in healthcare, both COVID facing, non-COVID facing, individuals over the age of 65, low income and affordable senior housing residents and staff, and then people with those 2 or more certain medical conditions. And then starting or effective on Thursday, March 11th, the K through 12 educators, childcare workers, and school and staff in Massachusetts are going to be eligible. So that group is getting bigger. And again, they're anticipating it's going to be at least a month to get through that group based off the current supply. And everybody, again, from the state is just getting pushed towards this vaxfinder.mass.gov. And I guess that is actually all I have for you guys on the slides and the updates.
Good. That's a big one. Quick but big. Well, let's hope we're through this.
Yeah.
And that's about it. Does anyone else do anything else?
No.
The restaurants are okay and inspections and that kind of thing is going to go forward, I assume.
Oh, actually, I do have a question about that, Mr. Chair, if I may.
Sure.
I've been asked by a couple of different restaurant, I don't know if they're owners or they work there or whatever. Is there somebody that a restaurant owner can call in your office, Kristen, that they can have somebody come out and help them figure out how to set up properly if they want to reopen, set up properly with the right screening or spacing or whatever?
No, so, that's a great question. Yes, we are here to support all of our businesses in town. Especially with navigating these and tweaks and questions about that. So we do have our new food inspector, Diane Legier, who has been doing just that, at business owners' requests. And so we're happy to meet with them to talk through any questions they may have, to provide printed materials on the state's reopening plan if they find that helpful.
Okay, perfect. Thank you.
Okay. Well, I think we will establish a tentative future meeting for April 13th, 2021.
That's
And
fine.
if there's nothing further, I'm going to move to close the meeting, to adjourn the meeting.
Yes.
Second.
All those in favor?
Aye.
Aye, aye. All right, all 3 of us have ruled unanimously in favor. And with that, we'll say good night.
Thank you.
Say good
Thank
night.
you.
Thank you.
Very good.
All right.
Everyone.
Good night, everybody.
Thank
Stay
you.
safe.
Yeah.
You too.